zReportage.com issue number 944 story of the week. Shell-shocked, growing up in Gaza. By ZUMA Partner agency APA photojournalists Abdullah Abu Al-Khair, Omar Ashtawy, Ali Hamad and Naaman Omar. The UN Agency for Palestinian Refugees, UNRWA, says more than 50,000 children in the Gaza Strip require immediate medical treatment for acute malnutrition. That's nearly a tenth of Gaza's population of children. Thousands of children have been cut off from nutrition care due to Israel's destruction of Gaza's health care system. There are now only 2 health centers left in Gaza that can care for children suffering from malnutrition. The UN's World Food Programme Deputy Executive Director Skau spent 2 days assessing the plight of Palestinians this week, saying the challenges are like nothing I have ever seen. The hunger crisis is only going to worsen as Israel continues blocking and denying aid. According to the WFP report, over 1 million Palestinians in Gaza, or about half the population, is expected to be experiencing famine-level hunger by July, the most dire category of hunger. Israel's near-total blockade of humanitarian aid has pushed tens of thousands of children in Gaza to the point of requiring medical treatment for starvation and malnutrition, the UN reported. With continued restrictions to humanitarian access, people in Gaza continue to face desperate levels of hunger, the agency wrote on social media, calling for a ceasefire. UNRWA teams work tirelessly to reach families with aid, but the situation is catastrophic. Hunger and starvation are extremely widespread among children in Gaza. In a report this month, UNICEF found that 90% of children had experienced severe food poverty in Gaza between December and April. The World Health Organization, WHO, reported last week that over 8,000 children in Gaza under the age of 5 have been diagnosed with acute malnutrition, including 1,600 who are diagnosed with severe acute malnutrition. The consequences of malnutrition and starvation can be extremely dire for children if left untreated, and have potential to stunt their development permanently. Worse, nutritionists in Gaza have reported that the widespread hunger is worsening disease among children, as their bodies are weakened and less able to fight, with groups reporting that an estimated 90% of children under 5 are affected by one or more infectious diseases. However, children are currently largely unable to access care for malnutrition in Gaza due to Israel's systematic destruction of the healthcare system in Gaza. There are only 2 health centers left in Gaza that can care for children suffering from malnutrition, WHO says. Further, just recently, nearly 3,000 children in southern Gaza were cut off from being able to receive treatment for malnutrition due to Israel's bloody siege of Rafah, according to UNICEF. The UN's most senior human rights official, Volker Turk, said in a BBC interview that Israel bore significant blame, and that there was a plausible case that Israel was using starvation as a weapon of war in Gaza. Source: truthout.org.